Free dental secrets. How to get $5,000 for crowns and root canals. Feb 2026 update. There is a government dental program in Canada right now, fully funded, federally backed, that could cover thousands of dollars worth of dental work for eligible Canadians. And most people who qualify have no idea it exists, or they've heard of it. But they applied once, got confused by the paperwork, and walked away. Or they were told by someone, a neighbor, a family member, even a dentist's receptionist, that it was canceled, or that they don't qualify, or that the money ran out. Some of that is misunderstanding, some of it is outdated information, and some of it is simply the gap between what the government announces and what actually reaches people at the kitchen table. My name is Joseph, and today we are going to close that gap. Because as of February 2026, there are specific updates to Canada's dental coverage program that every senior, every retiree, and every low to moderate income Canadian needs to understand before they spend another dollar out of pocket on a crown, a root canal, or an extraction that this program may have covered entirely. Stay with me. This is more important than most people realize. Let's go back to where this started because context matters. For decades, dental care in Canada existed in a strange blind spot. We had universal health coverage for hospital visits, for physicians, for prescriptions in many provinces. But your teeth? That was considered a private matter, something you handled through employer benefits or paid for yourself. The result was predictable. Millions of Canadians, particularly seniors on fixed incomes, low-income workers, and those without employer-sponsored benefits, simply stopped going to the dentist. Not because they didn't want to go, because they couldn't afford to. Statistics Canada data has shown for years that roughly 1 in 3 Canadians avoids dental care due to cost. For seniors relying on OAS and GIS old age security and the guaranteed income supplement, that number was even higher. A root canal in Canada can cost anywhere from $700 to $2,500, depending on the tooth and the province. A dental crown can run $1,000 to $2,500. A full set of dentures, $2,500 to over $5,000. These are not luxury procedures. These are medically necessary interventions that affect nutrition, speech, infection risk, and overall health. And for a senior receiving a combined OAS and GIS payment of $2,600 to $1,900 per month, those numbers are simply out of reach. This was the policy gap that the federal government moved to address first with a transitional program, and then with what became the Canadian Dental Care Plan, the CDCP, a program that has been rolling out in phases since late 2023 and into 2024 and 2025, and that now, in early 2026, has reached a critical stage that all eligible Canadians need to understand. Let's be very clear about what this program is and what it is not. The Canadian Dental Care Plan is a federally funded dental insurance program administered through Sun Life in partnership with the federal government. It is not a voucher. It is not a one-time check in the mail. It is an actual insurance plan with coverage for a wide range of dental procedures provided at no premium cost to eligible Canadians. And when we talk about getting up to $5,000 in coverage for procedures like crowns and root canals, we are talking about the annual maximum benefit available under this plan. For eligible individuals, the CDCP can cover up to $5,000 per year in dental services, with coverage percentages that vary, depending on the procedure and the individual's income level. Here is how the coverage tiers work, and this is important. If your adjusted family net income is under $70,000 per year, you receive 80% coverage on eligible dental services, meaning the plan pays 80 cents of every eligible dollar, and you may owe a co-payment of 20%. If your income is between $70,000 and $79,999, your coverage drops to 60%. And if your income is between $80,000 and $89,999, your coverage is 40%. Canadians with family net incomes at or above $90,000 do not qualify for this plan. Now, for many seniors receiving OAS and GIS whose income is often well below $30,000 or $40,000 per year, this means coverage at the highest tier. 80% on eligible procedures, up to that $5,000 annual maximum. For a root canal and crown that totals $3,000, an eligible low-income senior could see $2,400 covered. Their out-of-pocket cost, $600. Not zero, but dramatically less than the full $3,000. And that is the number that matters. That is the difference between a senior getting the dental care they need and a senior letting an infected tooth go untreated for months. Now, why are we talking about this in February 2026 specifically? Because several important developments have occurred in recent months that change the landscape of who can access this plan, how they access it, and what procedures are now covered. First, expanded provider access. One of the most consistent complaints about the CDCP since its launch has been that many dentists were not registered with the program. Patients would call their regular dentist, someone they had trusted for years, only to be told that the office was not accepting the Canadian Dental Care Plan. As of early 2026, the registered provider network has expanded significantly. There are now tens of thousands of oral health providers across Canada, including dentists, dental hygienists, denturists, and oral surgeons who are registered with the plan. This is a meaningful improvement over where the network stood in late 2023 and early 2024. But here is the important caveat. Not every dentist in Canada has registered. And that means if you have coverage under the CDCP, you must confirm before your appointment that your provider is registered with the plan. If they are not, you will be paying out of pocket and then seeking reimbursement through a direct pay model, which is more administratively complex. The government has a provider search tool on the CDCP website through canada.ca where you can search for registered providers in your area by postal code. Use it. Do not assume your dentist is registered. Confirm it. Second, direct billing versus reimbursement. As of the most recent program updates, the preferred model is now direct billing, where your registered dental provider bills Sun Life directly for eligible services, and you simply pay any applicable co-payment at the time of your appointment. This is the most straightforward approach, and it has become more widely available as provider registration has increased. However, the direct pay option, where you pay the full amount and then submit a claim for reimbursement, remains available for those whose providers are not yet registered. Understanding which model applies to you and knowing how to submit a claim correctly is critical to actually accessing the benefits you are entitled to. Third, coverage clarifications for major restorative work. This is where the $5,000 figure becomes most relevant to seniors dealing with significant dental needs. Major restorative services, which include crowns, root canals, and some forms of denture work, are covered under the CDCP, but with important conditions. Some of these procedures require what is called pre-authorization. This means your dentist must submit a treatment plan to Sun Life before the procedure is performed and receive confirmation of coverage before proceeding. If you skip this step, if your dentist completes a crown without first obtaining pre-authorization, you may find that the claim is partially or fully denied. This is one of the most common and costly mistakes being made by CDCP members right now, and it is entirely avoidable. If you need a crown, a root canal, or any major restorative procedure, ask your dentist explicitly, does this require pre-authorization under the Canadian Dental Care Plan? Confirm in writing before any work is done. Let's talk specifically about who this program is designed for and who is at risk of missing out. Seniors receiving OAS and GIS. If you are 65 or older, receiving old age security, and your income falls below the thresholds we discussed, you are in the primary target demographic for this program. Your dental needs are often significant. Your income is often limited, and the CDCP was designed in large part for you. Near retirees between 60 and 65. You may have recently lost employer-sponsored dental benefits, or you may be self-employed or working part-time with no coverage. If your income is below $90,000, check your eligibility now. Canadians with disabilities. Many Canadians under 65 who receive disability benefits and have limited income are also eligible for this program. If you or someone in your household receives CPP disability benefits and your family income falls within the eligible range, this is worth investigating immediately. Low-income working Canadians. The program is not limited to seniors. If you are working but your adjusted family net income is below $90,000 and you do not have access to private dental insurance, you may qualify. Families without employer dental benefits. Millions of Canadians in part-time employment, contract work, or small business settings have no workplace dental plan. The CDCP was designed to fill exactly this gap. The common thread across all of these groups is one simple condition: no access to other dental insurance and income below $90,000. If both of those apply to you, this program exists for you. Let me walk you through a realistic scenario, because policy language can feel abstract until you see it in dollar terms. Consider a 72-year-old woman living in Ontario. She receives $685 per month in OAS and $450 per month in GIS, a combined income of roughly $13,620 per year. She has no private dental insurance. She has been experiencing pain from a cracked molar for several months and has been putting off seeing a dentist because she cannot afford the cost. Her dentist diagnoses her and recommends a root canal, followed by a crown. The estimated cost, $2,800. Under the Canadian Dental Care Plan, with her income level, she qualifies for 80% coverage. That means the plan covers $2,240. Her co-payment is $560. For a woman living on $135 per month, $560 is still a meaningful sum, but it is not $2,800. It is the difference between being able to address a painful, potentially serious dental infection and continuing to defer care that could eventually lead to a hospital visit, far more costly to both her and the healthcare system. Now extend that scenario across a year. The CDCP annual maximum is $5,000. If she also needs a partial denture or a second restorative procedure later in the year, she has remaining coverage to draw from. This is real money, real relief. For a population that has been shouldering these costs or simply going without care for decades, it is worth stepping back and asking, why did the federal government implement this program now? And what is the long-term policy direction? The fiscal reality is this: untreated dental disease is not a contained problem. It leads to hospitalizations. It contributes to chronic conditions like cardiovascular disease and diabetes. It results in emergency room visits that cost the public healthcare system far more than preventive and restorative dental care would have. From a purely fiscal standpoint, investing in dental coverage for low-income Canadians has a rational cost-benefit argument behind it, beyond the humanitarian one. There is also the demographic dimension. Canada's senior population is growing rapidly. The baby boomer cohort is now fully in or approaching retirement age. The pressure on OAS, GIS, CPP, and health-related provincial programs will only increase over the next decade. Dental coverage that prevents more expensive downstream health interventions is consistent with a broader fiscal strategy of proactive health investment. The program also reflects a policy shift in how the federal government defines healthcare access. For the first time, oral health is being treated as a component of overall health, not as an optional private market service. That is a meaningful philosophical shift in Canadian health policy, and it has long-term implications for how we structure public benefit programs. The Canadian Dental Care Plan has received broadly positive assessments from dental health advocates and public health researchers who have long argued for expanded oral health coverage in Canada. Organizations representing dental hygienists and denturists have been generally supportive, while also noting implementation challenges, particularly around reimbursement rates. Some dental offices have reported that the fee schedules under the CDCP do not always align with prevailing market rates, which has been cited as one reason some providers have been slow to register. Patient advocacy groups representing seniors and low-income Canadians have raised concerns about the complexity of the application and claims process, particularly for individuals who are not comfortable navigating online government portals or who lack access to reliable internet service in rural and remote areas. These are legitimate operational challenges, and they are ones that Canadians should be aware of, not to discourage them from applying, but to set realistic expectations about the process and to know that support is available. Service Canada offices can assist with applications. The CDCP helpline operated through Sun Life is available for coverage and claims questions, and community health centers in many provinces have staff who can assist eligible individuals in navigating the enrollment process. The program is real. The benefits are real, but accessing them requires some navigation, and knowing where to turn for help is half the battle. If you have been listening to this and thinking this program might apply to you or someone you care about, here is exactly what to do next. Step 1. Confirm your eligibility. Go to canada.ca and search for the Canadian Dental Care Plan. The eligibility criteria are clearly outlined. The key conditions are: you are a Canadian resident with a valid CRA account, your adjusted family net income is below $90,000, and you do not have access to private dental insurance. You must also be enrolled in the program. Eligibility alone is not enough. You must have applied and been accepted. Step 2. If you have not applied, apply now. Applications are processed on a rolling basis. You can apply online through your My Service Canada account or by calling Service Canada. Do not wait until you have a dental emergency to start this process. The enrollment timeline means there can be a gap between application and your coverage start date. Step 3. Confirm your dentist is registered. Use the provider search tool on canada.ca before your next appointment. If your current dentist is not registered, either ask them about registering. Some practices simply haven't gone through the process yet, or locate a registered provider in your area. Step 4. Understand pre-authorization requirements. Before any major restorative work, crowns, root canals, complex denture work, ask your dental provider explicitly whether a pre-authorization request must be submitted. Do not assume. Ask and get confirmation before treatment begins. Step 5. Keep documentation. If you go through the direct pay reimbursement route, keep all receipts, treatment records, and any correspondence from Sun Life. Claims must be submitted within a specific time frame, typically 12 months from the date of service, so do not let paperwork accumulate. Step 6. Review your coverage annually. The program has a benefit year structure. Understanding when your coverage resets and planning significant dental work accordingly can help you maximize the benefit you receive over time. Looking ahead, there are several dimensions of this program worth watching closely. The provider registration rate will continue to be a key variable. The more dentists and oral health professionals who join the program's network, the more accessible the benefits become for Canadians across all provinces and regions. Monitoring whether provider uptake continues to grow or whether fee schedule disputes limit expansion will matter. There is also the question of program sustainability. The CDCP represents a significant federal expenditure, and as with any public benefit program, it will be subject to future budget reviews and potential modifications. This is not cause for immediate alarm. The program is now operational and has enrolled millions of Canadians, but it is a reminder that understanding and using your benefits now, while the program is in its current form, is the prudent approach. There may also be future expansions or adjustments to eligible procedures, income thresholds, or reimbursement rates. Staying connected to credible information sources about CRA rules, federal benefit updates, and senior benefit policy in Canada is the best way to remain ahead of any changes that could affect your coverage. The Canadian Dental Care Plan is not perfect. No large-scale government program launched under time pressure ever is. There are administrative hurdles, provider gaps, and claim processes that can feel unnecessarily complex for people who simply want to see a dentist. But it is real. The money is there. The coverage is there. And for millions of Canadian seniors and low-income Canadians, people who have been quietly managing dental pain, deferring necessary procedures, or spending money they cannot afford, this program represents something genuinely significant. The question is not whether the program exists. The question is whether you are positioned to access it. If this video has helped clarify that if it has given you or someone you know the information needed to take the next step, then it has done its job. I am Joseph. If you found this analysis useful, please subscribe to this channel. We cover Canadian pension policy, senior benefits, CRA rule changes, and retirement income issues with the same level of seriousness and care that these topics deserve. Share this video with a family member, a neighbor, or anyone you know who might be eligible for this program and doesn't know it yet. And if you have questions about your specific situation, about the application process, or about anything we covered today, leave them in the comments below. I read them. I respond. And your question may become the focus of a future video. Stay informed, stay protected, and take care of your health, including your dental health. You have earned it.